Good morning, everyone. We're here today at the airport in Wellington because under our plan, Kiwis will be able to fly. Today, I'm very proud to release National's plan, Opening Up. National's plan to tackle Covid-19, end lockdowns and reopen to the world. It is now 18 months since New Zealand closed its border due to the Covid-19 outbreak. When New Zealand shut our borders to the world, the Prime Minister described this as a temporary measure. But 18 months on, Kiwis don't know when the temporary measures will end. Around 1 million Kiwis are stuck overseas, cut off from their own country, their own families, for 18 months. With no time frame for when they can come home, New Zealand's elimination strategy did work, and it got us through the period when vaccines weren't available. But under our elimination plan, our government's debt almost doubled. And over the last 18 months, Auckland has spent a total of 17 weeks in lockdown. That is 17 weeks that kids haven't been able to go to school. That's 17 weeks that people have been isolated at home alone. And that's 17 weeks that businesses have been losing money. Elimination had its role, but now we need to vaccinate our way out of lockdowns and isolation. Labour is not being upfront with Kiwis. And on Friday, Minister David Parker was saying 90% vaccination and people can get all the freedoms back. Sunday, we had Minister Chris Hipkins saying he isn't latching on to particular numbers. And then on Monday, we had Prime Minister Ardern and Grant Robertson saying elimination is still the goal. Frankly, the government is all over the place. National knows that if we want people to come with you on a journey, you need to tell them where we're going. Kiwis have done the hard yards over the last 18 months to keep the country safe, and they'll now need to see that there is a plan to end lockdowns and reopen to the world. And National has prepared that plan. If adopted, National's plan means Kiwis overseas could come home to spend this Christmas with loved ones, or take an overseas holiday for New Year's. And before I announce the details, I want to thank the Members of Parliament and the hard-working National Party staff who have pulled this plan together over the last 6 weeks. This has been a team effort, a huge effort. Thank you so much for the work that you've been doing. And I also want to thank the experts who have reviewed our plan. A lot of hard work and research has gone into making sure every opportunity is covered. So let me come to the plan. National proposes that New Zealand both supercharge our vaccine rollout and massively enhance our contact tracing, testing and isolation measures to safely end lockdowns and reopen to the world. Pillar 1 of our plan is to invest, to set ourselves up to reconnect to the world. And under this pillar, National outlines our plan to supercharge our vaccine rollout, including going door to door in vulnerable communities, to use technology like saliva testing and rapid antigen testing to find more cases faster, to establish a new dedicated COVID-19 response agency, Te Korowai Kokiri, and to invest in hospitals, intensive care capacity and new COVID treatments. Our investment pillar is all about setting ourselves up to end lockdowns and reconnect to the world. Pillar 2 of our plan is evolve. Under Pillar 2, we evolve to a new approach of using technology instead of lockdowns. Pillar 2 is triggered when New Zealand reaches the milestone of 70 to 75% vaccination. And once New Zealand reaches 70 to 75% fully vaccinated, we can end nationwide lockdowns. With 70 to 75% fully vaccinated, we can end the economic and social damage lockdowns cause. Finally, Pillar 3 is to open. Pillar 3 is our pathway to reconnect New Zealand to the world. utilising the investment in testing, tracing and isolation and invest. And by reaching a milestone of 85 to 90% fully vaccinated, New Zealand can open to the world. Travelling under Pillar 3 will be new. Countries will be specified into green, orange and red zones. If you are coming from a green zone country and are fully vaccinated, you can travel freely into New Zealand. You simply complete a test before leaving and a rapid COVID test at the airport on arrival. Pillar 3 makes it possible for Kiwis to come home for Christmas or take an overseas holiday at New Year's. Orange travel will recognise that double vaccinated travellers pose less risk but still require 1 week home isolation and use of an app to check in daily. Red zone travel will be recognisable as a system that everyone is sent through today. Although with the majority not needing it, the backlog will be largely gone. Unvaccinated Kiwis will also need to return home through our current MIQ system. For green and orange zones, our immigration settings go back to normal. Students, tourists, workers can come back. However, non-citizens and non-permanent residents who are unvaccinated simply cannot travel to New Zealand. For non-citizens and non-permanent residents, it's no jab, no entry. Pillar 3 is not about compromising on health. Pillar 3 is about moving from an elimination strategy to a vigorous suppression strategy. We accept a tolerance for a low level of COVID in the community, but vigorously suppress cases when they occur. Through testing, contact tracing, isolation and quarantine, we know elimination cannot work forever. And it is only ever a strategy to see us through until this point, the point at which vaccination and technology could support a vigorous suppression strategy. So National's plan is clear, simple and comprehensive. Our plan provides a pathway for Kiwis to get behind. It shows New Zealanders a game plan to ending lockdowns and opening up to the world. Our plan is about providing a path forward and reconnecting New Zealand to the world. And if the government follows this plan, if Kiwis get behind this plan, New Zealanders will be able to spend Christmas with their loved ones rather than being stuck overseas. I will now pass to National's COVID-19 response spokesperson, Chris Bishop, who will touch on a few extra details of the plan and who has been leading the team on putting this plan together. Thank you, Chris.
Thank you, Judith, and can I thank Dr. Shane Retty, Simon Watts and Erica Stanford for collaborating with me in developing this very ambitious plan. On Monday, the Prime Minister said she was confident New Zealanders could enjoy a classic Kiwi summer. Most Kiwis regard summer as a time to travel and catch up with friends and family they haven't seen for a while. Grandparents who come back from overseas for a summer break to see the grandkids. The lawyer in London who comes home for a few weeks to escape the London winter and enjoy some beers at the beach with long-lost mates. And Kiwis who go the other way, who journey across the ditch to Oz, maybe to catch some cricket, maybe some music festivals. Under Labour, there is no plan to allow those things to happen this summer. The reality is that after 18 months of COVID, Labour doesn't know what to do next. The Prime Minister says they don't have a vaccination target. The next day, Ashley Bloomfield says they do. It's 90%. Prime Minister says one day she wants to reconnect to the world. Then Chris Hipkins says the very next day, everything's up for debate. They're rethinking everything. Today, the government is announcing a 150-person pilot for business people to self-isolate. It's pathetic. Is this really what we've come to as a country? 150 people running, 150 people self-isolating, plus running a lottery in human misery every week to see who gets the privilege of entering New Zealand through MIQ. It's like the Hunger Games, except it's not fictional. It's Kiwi citizens' lives we're talking about. We can do better, and under National's plan we would do better. I want to expand a little on the details outlined by Judith. Pillar 1 of the plan contains a number of steps we think New Zealand needs to take in our health response. Vaccination is the most important, and we're putting forward 11 positive initiatives to supercharge our vaccine rollout. Yesterday was our slowest day in first dose vaccinations since early July. We've got to get the numbers up. We're still not using GPs properly. We're still not using pharmacists properly. The red tape is suffocating. We should be using GPs, and we should have been using them far sooner. John Tamahiri and the Waipareira Trust are doing a great job, but they can't access government data held by the DHBs, so they can go out and find those hard-to-reach communities. Let's give them that data and make sure that they can use it. Throughout the rollout, there's been a very top-down approach driven by the Wellington bureaucracy. So we propose establishing a rangatahi advisory group to actually ask young Maori how we can get them vaccinated. You know, sometimes all it takes to find a good idea is a bit of listening to the community. We need to do whatever it takes. Set up a vaccination clinic in Courtenay Place or the Viaduct. 2/3 of people in this most recent Delta outbreak who've got COVID are aged under 30. Go where they go, set up vaccination clinics and vaccinate them. Do whatever it takes. Find 10 economists, throw them into a room, give them a week, tell them to come up with the best ideas for incentives and then fund them. Some will fail, some will work. It'll still be worth it because every extra person we get over the line for vaccination makes a material difference to the future prosperity of this country. The government has no plans to vaccinate in schools before the end of the year. What a wasted opportunity. Let's get on with it as soon as possible. And while we're at it, we should mandate that healthcare workers in COVID-19 work streams are vaccinated. It's disgraceful that 9 months into the vaccine rollout, we still have healthcare workers potentially working on COVID patients who don't have to be vaccinated. Make it a rule. Do it yesterday. You know, there should be an inquiry into saliva testing in New Zealand. It was recommended a year ago as an urgent priority by the government's own expert advisor, Sir Brian Roche. We should be using it daily for residents in MIQ and for our border workers. It's less invasive, it's cheaper, it's just as accurate as the nasal tests. And we should be contracting a surge provider for surge capacity testing when we have outbreaks. In the first 2 weeks of this most recent outbreak in Auckland, people lined up for 12 hours to get a test. Some people ended up in the line and gave up. They went home. And some people probably didn't even bother to get a test because they saw the lines and didn't want to bother. All the while, Rako Science can do 10,000 tests a day. They were unused by the ministry. A wasted opportunity. We should be doing regular saliva testing in our public hospitals like Middlemore, for example, as well. We need to end the ban on rapid tests in New Zealand. We should be using them for essential workers crossing the Auckland border right now. At the moment, people have to get a test every week. And as we know with Delta, it moves so quickly, it means you could get COVID, spend 6 days driving in and out of Auckland into the Waikato, have COVID, and not have to be tested. We should be using rapid testing on a daily basis for essential workers right now. Our aim is to have rapid tests ubiquitous in the community by mid next year. There's lots more I could talk about. The plan includes our proposals for purpose-built quarantine, which I see the Victorian government is doing in Australia on a very similar lines to what National proposed in February. We need a proper digital app for vaccine authentication. People are walking around carrying the little cards that they get when they get vaccinated. We should be able to show very quickly and simply on our phones that we've been vaccinated. We still haven't bought or approved any next generation treatments for COVID. Some of the novel monoclonal antibody treatments that are showing huge promise, like Ronapreve. We are miles behind other countries that are ordering these treatments by the truckload and approving them increasingly. We have not ordered any, we have not approved any. We are miles behind the 8 ball in other countries. I'll soon hand over to Dr. Reti, but I just want to finish by talking about travel under national. Under 85%, it's game on. At that point, we will have one of the highest vaccination rates in the world. And I want to send a very clear message to Kiwis listening around the world today. I know many have tuned into the live stream. Many of those people watching feel alienated from their country, and led by a Prime Minister who said yesterday, MIQ isn't a lottery. My message to them is this: National values you. We know that Kiwis travel, and we know that you didn't ask for COVID either. We want you to be able to come back to New Zealand. National's travel plan allows that to happen. Fully vaccinated travellers in low-risk jurisdictions can come back without going into quarantine with a negative pre-departure test before leaving and a negative test on arrival. Fully vaccinated travellers in jurisdictions like the US and the UK be able to come home after isolating for a week. We would clear the human misery lottery that is MIQ in a week. National's plan allows Kiwis to come home and it allows Kiwis to travel. It's a comprehensive, ambitious plan for New Zealand's future, and we put it forward to the consideration of the New Zealand people, and we're very proud of it. Dr. Reddy.
Good morning, everyone. The purpose to New Zealand's coronavirus response has been to keep New Zealanders safe and to protect the health system. We look to contribute to the discussion around what it means to protect the health system and the impact on health resources when relaxing community and border settings. These settings are similar to the current policy settings in the UK and Norway. No models incorporate all of the levers available for a coronavirus response. Some models have focused on border settings, some have focused on community responses, including public health measures such as masking, social distancing and lockdowns. Others have focused on system measures such as testing, tracing, isolation and quarantine. Using some of the models to make very broad estimates of health system impact around relaxing community and border settings, some estimates can be made. I would add that this is only a direction of travel and not a final destination. We do not suggest that policy settings wait until any new resource is built, but rather that further threshold analysis and modelling be undertaken around the impact on the health system, and that short, medium and long-term plans take into account requirements for human resources and capital resources as part of coronavirus management. We would note that as it has been in the current outbreak, human resources are likely to be the critical gateway, requiring policy settings at immigration and tertiary education levels. We can learn much from other countries as they relax their policy settings and what impact that has on the health system for them, that we might take that into account also. Thank you.
Well, thank you very much, Dr. Reddy, and good morning, everyone. National's COVID-19 plan is focused on building a strong health system, and step 10 of National's plan, opening up, includes a strong priority on improving our hospitals and expanding our ICU capacity. It is shocking, but perhaps unsurprising, that we've seen a number of failures through the latest outbreak. Failures that show that this government were not ready, that this government were not prepared. National's plan involves urgently implementing a specialist healthcare workforce migration plan. We would select the 3,000 doctors and nurses out of the expression of interest pool and process them urgently. We would also prioritise and fast-track resident applications for critical healthcare workers, setting aside dedicated MIQ spaces if required. National would offer conditional residence class visas upon arrival to specialists, experienced nurses who have the qualifications and experience needed to immediately start working in New Zealand. We would also support migrant nurses already in New Zealand to complete competency assessment programs and terms, and also support them with examination fees when necessary. The other important element is to increase the healthcare student enrolment numbers at training institutions, to increase long-term labour participation rates and get New Zealand aligned with OECD benchmarks. Increased medical workforce would be dealt with by providing for more postgraduate Year 1 roles within DHBs, and importantly, focusing on retention. And most importantly, we would also fast-track the building of new hospital wards to increase bed capacity and ICU capacity. In Auckland alone, we're aware that there are business cases for projects that could be progressed immediately, and under National, we would get those going. National wants New Zealanders to enjoy more of the freedoms they have had before the pandemic hit. And to do this, we must make sure that our health system is robust enough to deal with the people that will fall ill as a result of COVID-19, but most importantly, to continue the day-to-day operations. I'll now hand over to Erica Stanford, Shadow Immigration Spokesperson.
Well, good morning, everyone. I'm really happy to be here today to help deliver National's plan and to help us reconnect to the world and provide certainty. Firstly, certainty, as we've already talked about, for those many Kiwis offshore, who, when we talk about the team of 5 million, very quickly excluded them and left them to the overseas, not being able to come back. And it created a sense of anxiety and stress and isolation for those people who were unable to come back to visit family, to see loved ones before they passed, and also attend funerals, all for medical reasons. We very quickly turned this into a great miserable lottery, creating more stress and anxiety for people who then saw that there were 20,000 people ahead of them in the queue. And then, of course, there's the other lottery of the emergency allocation system, which for many people has been incredibly stressful and difficult to navigate, with many declines where there should have been people being accepted. That will all change under this plan. Those people needing to get home for emergency reasons will not have to go through the emergency allocation lottery. Instead, will be able to get home to visit loved ones and for those emergency situations. This also has a huge impact on our migrant community, who we realistically have been treating like second-class citizens for the last 18 months, especially those who've been split from their families for the last 18 months. Those migrants who've been getting up every day, teaching our children, looking after our parents in aged care facilities, working on our dairy farms, trucking our goods around, working every day for the betterment of our society and our economy, and haven't seen their own children in 18 months. And that has been a stain on New Zealand that we have allowed that to happen. This plan changes that. It allows our split families to be reunited and reconnected in a safe way using our traffic light system. I'm really excited actually about the prospects that New Zealand has in terms of our health response and our economic response when it comes to immigration. This plan offers certainty to bring back and bring in our very important skilled migrants that will help get us out of the COVID economic mess that has been wrought on this country in the last 18 months, to help kickstart our economy, to deliver those skills that those businesses around New Zealand desperately, desperately need. Part of our plan is to fix our broken immigration system. We have had, or we currently have, years-long delays in getting residents. We've got long queues of misery. This plan, today announced, allows us to clear the decks, offer a fast-tracked process to residency, to firstly keep those valuable migrants we already have here in New Zealand, and secondly, repairs our international reputation that has been so badly damaged over the last 18 months. We used to be a destination where skilled migrants wanted to come, but with a residency queue years long, that has all changed. So if we want to get the best talent into New Zealand, we have to clear those residency decks and create a fast-track pathway to residence so that they have certainty knowing if they bring their skills here, they can make this place their home. The second part of our plan to keep those valuable migrants here is to offer a pathway to residence for all of those essential skills workers working in New Zealand right now, who stuck with us through the pandemic, who are working on our dairy farms, trucking our goods around, working in our aged care facilities, that they have the certainty of a place here in New Zealand that would be fast-tracked. If New Zealand wants to be the best, and we need to have the best talent, we need the best immigration system possible. And right now, it is the worst immigration system, a broken immigration system that needs fixing. National has a plan to fix that system, to keep our valuable migrants here onshore, and to attract the very best talent from around the world. Thank you very much.
Okay.
Take your questions.
Take any questions?
How can you promise that Kiwis will be able to come home, for fully vaccinated Kiwis will be able to come home for Christmas, when your plan isn't a timeline, it's a prerequisite of 85%? What if 85% isn't reached by Christmas?
We'll get going with it.
Right, you've got to look at the plan as a whole and in totality. Our plan supercharges the vaccine rollout. We can get to 85% by Christmas time. We can do that. The government needs to pick up some of the very sensible ideas we've got in our plan, make it happen. There's no reason why we can't get to 85%. There's a lot of people out there who want to get vaccinated. We can get there if we get there. As I said, 85%, it's game on.
But if we're not there by Christmas, then you can't open by Christmas, right?
Well, I mean, by definition, the milestone is 85%. We want the government to get there. We want the government, once it gets to 85%, to reopen.
Under your supercharged vaccination plan, how quickly will you get to 85%?
Well, as I say, I reckon we can get there in the next, in the next couple of months by Christmas time. I think it's eminently possible. We've got to get those first doses up. And, as I said in my speech, we had the lowest number since early July, just yesterday. So we've got to get those first doses up, and then, of course, once you get those first doses up, the second doses, I think the numbers are 95 to 98% of people get a second dose as well.
Do you have any modelling to back that up, 85% by Christmas?
I mean, not in the sense of, models of the number per day, but if you just look at what's happened over the last 9 months, or the last 6 months in particular, there's every reason to suggest we can get to 85% by Christmas. It's just we need Nationals' ideas. We need to go door to door. We need to use incentives. We need to establish groups like the Rangitaki Advisory Group and actually go and talk to people on the ground who are vaccine hesitant, take a much more grassroots approach. We need to mandate in healthcare settings. We've got a suite of measures that if the government adopted properly and effectively, we would get to 85% in the next few weeks.
When you get to 85%, is your promise for Kiwis there will be zero delays coming home?
Zero
Delays. Is that your promise?
No, you've got to put in the whole policy. I mean, it's not just pick one, pick the other. The government is being invited to take our entire policy, put it together, and just do it. So part of what they have to do is that they have to put in the traffic light system. They've got to get the vaccinations out. They've got to make sure they've got the apps ready. They've got to use the technology. They can't simply keep blaming New Zealanders for us being in lockdown. They have to take responsibility. There's the plan. We're not trying to keep it to ourselves. We're saying, here it is. We've put it together. We want to share it because, we want New Zealanders to be able to come home, and we don't want families to be split. This is outrageous what's happened to our country, to the 5 million people here, but the million Kiwis overseas who have just been left to, as Chris says, this lottery of MIQ and this heartless attitude of, we'll give out 3,000 places someplace. I mean, this is outrageous what's happening, and we have an economic response that is now going to be, our economy is going to be severely tested by what's going on.
The Sean Handy model improves at 85% for 12 plus. There would be 4,314 deaths. Are you comfortable with that risk at 85%?
So the Hendy modelling has been challenged by other noted modellers, as you would know, of course, as well. And of course, no one has yet built a model that incorporates all of the various elements and all the various variables in any plan. So no one has yet built a model that specifically models some of the things that we're talking about, for example. So no one wants any COVID in the community, but the simple reality is Delta is here in New Zealand right now. We had another number of cases yesterday, and we have more cases today, of course, as well. And so what we've got to get to is gear up our health system to respond. And we think National's plan is one that does that through rapid antigen testing, through saliva testing, through buying more COVID treatments. You've heard Simon and Erica talk about the immigration plan to urgently upskill our nurses and bring in the doctors and nurses that we need. And we're very confident that with our plan, we can safely reopen to the world, but also cope with COVID in the community.
It's very clear is that vaccination is the most important thing that can happen. But it needs all these other pillars, I would say, or assets that we would put into it. That is important.
If National's plan was fully adopted, do you have any estimates on how many COVID cases there would be a year or how many deaths there would be a year, just in the same line as the handling model?
We would anticipate a low number of COVID cases. This is not a free-for-all. This is a strategy of vigorous suppression. So at the moment, the government at least says we have an elimination strategy where they have a zero tolerance for any new COVID cases. We are explicitly saying there will be COVID cases. And the reality is the government knows that and thinks that too. The Prime Minister is trying to run this line that you can reopen to the world and reconnect which is stated government policy, and have no COVID. We're being intellectually honest and being upfront with New Zealanders that that is not possible. Experts are pretty much united that with Delta, if you open the borders even slightly, Delta makes its way into the community. And it happened even with an elimination strategy with very, very tight border settings. It's here now. It will come back. We're being upfront and honest and saying Delta's here. It's going to come back. There will be COVID in the community. And we need to reopen whilst making sure we mitigate the impacts of COVID and have a low number of cases as much as possible.
How can you say that there'll be a low number of cases?
Sorry, Jessica?
You've talked a lot about the groups of people who are overseas. There are still a chunk of the population here in New Zealand who feel really nervous about opening up, and even at the 85% mark. What reassurances can you give to that group?
I think it's really clear is that if they only see and hear 85% vaccination with nothing else around it, such as ICU beds, such as COVID tracing apps, all the other pillars, or let's say all the other elements of our strategy, then people will sometimes be nervous. But what people can also be very nervous about is that while we're in lockdowns, people who should be getting cancer assessments are not necessarily getting those assessments. They're finding out about cancer months later than what they should. They're finding out or getting heart assessments months later than what they should. People are currently not able to access some of the treatments that they should have been able to, and particularly under the level 4 lockdown. We have people, just in the newspapers today or media today, a father, he and his wife having triplets, he can't get across the internal borders to get to be with his wife for a birth of triplets. How can that be acceptable in a country like ours?
Do you feel comfortable with the fact that we'd have 15% of the eligible population unvaccinated, and then we'd have a chunk of the population aged under 11 non-vaccinated? Does that sit comfortably with you that those two groups of people would not be vaccinated?
We believe that with the efforts that we believe need to be put in place around vaccinations and incentives to be vaccinated, that more people will want to be vaccinated. But we also understand that it is very difficult, and every country has had some difficulties, a lot of difficulty getting over 85%. But we've had 85% vaccinations and all sorts of things. And, and Dr. Reti is possibly better able to speak to that, because we know we can do it, but people need to know it's not only vaccinations. And that's why all these other mechanisms must be in place. The government has had 18 months to do this. They haven't done it. They haven't put in a plan, and so we're giving them the plan.
Can we go to Dr. Reddy about the situation in Northland, where you've got 38% vaccinated, where even the former National Party MP Matt King has posted on his Facebook anti-vaccination data, anti-vaccination statements. Now, how are you going to persuade Matt King and the rest of Northland to get vaccinated?
You'll have seen this week the CEO for Northland DHB, Dr. Nick Chamberlain, come out seeking to reassure the Northland community that we believe the vaccine pathway is the pathway for New Zealand to assume some sense of normalcy. And he carries a lot of weight, Nick. I respect him and thank him for the work he's doing. Those of us in the community who work with patients, we believe in the vaccine. We believe that it will help us return to economic and social survivorship, if you like. And so conveying to the community that in the science as we see it, we believe it's effective, will help bring those on board, we believe. Give them the right information, and we back people to do the right thing, fundamentally, including Matt King.
What's your message to him, Judith Collins?
Well, look, my message is that it is much better to be vaccinated than not vaccinated. We also know, and the Prime Minister often talks about breakthrough cases around the fact that people, even who are vaccinated, can still get COVID-19 and can transmit it. Very few cases, but can happen. We understand that. That's why everything else has to be in place as well. And I think, unfortunately, people get mixed messages about it. The longer this vaccine rollout has been taking, the more opportunities there's been for people to get mixed messages and all sorts of conspiracy theories. People when you think about the absence of the vaccine rollout, 20% of the eligible population was vaccinated by the time this last lockdown happened. That is an absolute tragedy, because it's meant that this lockdown's gone on, and in all that time, when the government should have got people vaccinated while people were really keen and they could see a point to it.
So you think those delays and therefore it's on the government that kind of
Absolutely.
kind of anti-vax sentiment?
It is, well, obviously I don't agree with the anti-vax sentiment at all, but the government has an opportunity, or had an opportunity, to get the vaccines rolled out really quickly while everyone was actually very excited and positive about the fact that there was a vaccine available. And now, the longer it goes on, the longer and the more difficult it is to get people vaccinated unless they can see a pathway for them to opening up. And what they're seeing from the government at the moment is just the threat of more lockdowns. We have to have a better way. Ours is a better way. We can open up and we can give New Zealanders the certainty that they need and the reason for them to get vaccinated if they're at all hesitant.
What role do you see?
Modelling quickly. That's the gamble, isn't it? At 85% over 12s, the gamble is 4,500.
No, it's not, because as Chris has very carefully said, that the Hindi modelling doesn't take into account all of the measures that we propose putting in place.
If you take all of those measures, you still will have almost 1.5 million people unvaccinated at 85%. How can you credibly say there will be low case numbers in New Zealand with all your measures in place with 1.5 million unvaccinated people?
Well, do you want to comment on that?
No, you go here first.
I mean, the point is that 85% would give us one of the highest vaccination rates in the world. The moment we get 5 to 11-year-olds approved, which most people assume will happen in the next few weeks, including the Minister, the moment we get 5 to 11-year-olds approved, and I think this also speaks to Jess's point, we should be ready to go. It took us 2 months between MedSafe approving 12-year-olds and above before the government gave the green light. We should be doing that in schools. But I'm answering your question. At an 85% vaccination rate, that is a very high level, and alongside contact tracing, isolation, mass testing, surveillance testing, but also community testing through rapid and saliva testing, we can have surety and confidence that there will be COVID in the community. Yes, we accept that. We're being upfront and honest about that. There will be COVID in the community. It's about how you deal with the COVID in the community, and we're confident with the measures that we're suggesting and proposing, we can deal with a low level of COVID in the community.
Do you want to comment on that? Remains a low level of COVID in the community with 1.5 million unvaccinated Kiwis. Your 85% plan is not 5 plus, it's 12 plus. So that's almost 1.5 million unvaccinated Kiwis. How can you say there will be low COVID in the community?
Well, I think I've given you the answer. I'm not going to repeat it. I've given you the answer.
Yep.
How many people do you think that, sorry,
How high would hospitalisation, would hospital ICU beds need to get to be able to deal with that? Because realistically, you can't get ICU beds up in the next 3 months. There's not enough staff, there's not enough infrastructure. So can the current ICU capacity deal with the kind of surgeries that you see out in your plan?
The current ICU capacity won't cope, because remember, our solution has been to lock people down so you don't get accidents turning up in ICU. And it's also been to slow down elective surgery so you don't get people unexpectedly then going into ICU. So under outbreak, we've had a surge capacity sort of model, stop those things from happening. What we're saying is that if we accept an endemic level of coronavirus in the community, we're going to need new resource to deal with some of the peak hospitalisations and peak ICU capacity that's going to be required. That will be ICU beds, it will be ICU nurses. It's also, remember, it's ward beds, because you can't move a person out of ICU if there's not a ward bed for them to go to. So sometimes the hurdle's actually being the ward beds. So it's a combination of things, human and physical capital.
We could always bring in those nurses and doctors who are so desperate to get into New Zealand to work here. That would be an idea that the government could have actually put in place in the last 18 months, but it's chosen to do so.
And you say this is without measures that you have peak hospitalisations at 85% of 765, so that's sensitive people in hospital across the country, a lot higher than we've seen at any point during this outbreak.
That's right, yeah.
Could the current system deal with that?
No, it could not. I mean, we were struggling to be, we were almost overwhelmed. September the 1st, if you recall, we had 8 active cases in Auckland, and they urgently called out for 30 ICU nurses. So with 8 active cases, that was a problem there and then. So there's new capital and new resources, human resources.
So they need to do it now.
Does it even happen in 3 months?
Yeah, it can. Oh yes, it can. If you've got a government that actually really just wants to make it happen, oh yes, you can. The difference is, I've been in senior ministerial roles before. I know exactly what can happen. If you really need to, you can make it happen. What we've seen is 18 months of lockdowns, threats of lockdowns, various reasons why nothing can happen. We have a vaccine in the community now. The government needs to complete its rollout, needs to get those ICU beds staffed. They need to get them in place now. They've got 3 months to get it done. Just do it and stop making excuses. And Henry, one of the things I've looked at this government, all these opportunities, all these nurses and doctors and specialists desperate to be in this country, or those who are here now looking to go overseas because they see no way forward. We can do it, but the government needs to follow our plan. Down the back, sorry.
Yes, I'd like to applaud the party for having a plan for a start. The question around non-vaxxers who refuse to vaccinate, businesses, sporting clubs, recreational organisations are at the forefront and are suffering from not being able to get out and about. What tools are you going to give those organisations the ability to refuse entry, access, or services that non-vaxxers are refusing, who are refusing to get vaccinated, so they can get up and running?
Okay. All right. Well, we believe that every business, every organisation has the right to decide who comes onto their premises. So under the health and safety legislation, every workplace or even premises have the right to decide. And so they will need to make that assessment. There's going to be some where they're going to say that there is no particular risk for them, and others where they're going to consider it is a significant risk and they will require people to be vaccinated, which is why, as we've outlined, there needs to be a mechanism for people to show if they need to, whether or not they're vaccinated. I mean, I've got a card with my 2 little vaccination dates and signed on it. A lot of people in Wellington were being given cards with nothing on them, and those cards could easily be faked. So that is simply not good enough. It should have been in place. It can be in place. The government needs to get onto it.
Would you be comfortable with Air New Zealand mandating? Would you be comfortable with Air New Zealand mandating a vaccination requirement travelling to this country?
Yes.
It's their choice.
How do you reconcile those positions, though, with your statement the other day that you didn't want to divide New Zealand into 2 groups, vaccinated and unvaccinated?
Well, we don't want to have people to have a different jacket on than somebody who isn't vaccinated. What we do believe is that every business, we believe in the National Party and personal responsibility. We also believe in private property rights. That means that people can decide who comes onto their premises. That's not at all inconsistent. It is absolutely consistent with our stated views.
With the New Zealand
Yes, Tova.
that you were asked about, you said, Collins, that it was their choice. You
Yep.
said yes, which is it?
Well, yes,
He's agreeing with me.
I'm agreeing with you. Yes, we would be comfortable with that.
Yeah.
The question was, would we be comfortable? The answer is yes.
Yeah, it's their choice.
Their choice.
What are supermarkets asking?
Well, it's their choice.
Even though that's an essential service.
It's their choice.
So you wouldn't have any issues with someone who's unvaccinated effectively having no access to food or perhaps some medical care in that community because the private businesses have chosen to use unvaccinated customers?
I doubt that it will come to that, and I expect that people will make their own choices. As everybody who chooses not to be vaccinated has the ability to make their free choice, there are always consequences for those choices, and I think that people will want to get vaccinated.
How is the things going to hit the clubs and get a jab?
Hit the clubs. That's probably your territory more.
She means go to nightclubs. I'm way too old for nightclubs these days. As the leader, as Judith says, people make their decisions. If you're a massive drum and bass fanatic, I don't know why you would be, but if you are, and one of those conditions of going to drum and bass post midnight is you get vaccinated, then you probably go and get vaccinated. And that's probably a good thing. It's probably a reason to do it. If you decide that your personal choice not to be vaccinated outweighs your love of drum and bass music, well,
your
okay,
choice.
That's your choice. Good luck to you.
Are there any
You know?
issues there about vaccinating people when they might be out on the RAS?
No.
Just about which experts you've been engaging with it in order to come up with today's policy?
Do you want to? No, you We're not naming the experts that we've engaged with publicly because they are in prominent positions who and essentially don't wish to be named publicly, but we can indicate some of them to you afterwards.
What's the expectation for contacts of COVID-19 cases to isolate under your plan?
Sure.
We saw in the UK with a number of cases and their use of good technology, this sort of pandemic where lots of people had to isolate and they didn't know when they had been exposed and so on. Will people still have the same isolation expectations under your plan as they do right now?
So that will be a risk matrix as to what the isolation looks like, how much risk they are, what their capacity is to follow the policy settings of the day. So across that risk will vary from person to person, but we would certainly be looking to keep it simple. I think if you add in too many variations, people become confused with it and you start losing compliance. But it would be a risk matrix as to what potentially home isolation, for example, would look like. Where have you come from? What is your vaccination status? What were you vaccinated with? What is your capacity to follow the policy settings in your home? Those sorts of things would critique a risk matrix.
And that's sort of, is that an evolution of the current close and casual contact system, essentially?
Look, potentially it is. Certainly the Roche report was saying don't start breaking it into close plus and casual plus. And in fact, all we've done is add a new category called high risk. So why we didn't follow that, I'm not too sure. But anyway, yes, it would be a modification that we try and keep it simple within the close and the casual categories.
Would you still keep localised lockdowns in the toolbox at 85%?
Everything's, I think it'd be fair to say everything is in the toolbox, but once you get to 70 to 75, the prospect of a nationwide lockdown is gone. That's a key element of the plan, a pillar 2 of the plan. We've got to get away from these nationwide lockdowns. Yeah, well, last resort, absolutely, very last resort. And same thing at 85% for a localised lockdown. It's part of the toolbox, but the whole point is to get away from lockdowns. The whole point is to deal with cases as and when the community, when they arise, use enhanced contact tracing, use rapid testing, community surveillance testing, and all of the measures in the plan, alongside a very high vaccination rate to deal with COVID.
Expect a localised lockdown to be needed at 85?
We wouldn't expect it to be needed, but look, these are flexible situations you deal with at the time.
Your vaccine target has a few parameters to it, so you can't go from 70 for every age group and 80 for every 80 for every DHB level.
Mm-hmm.
Why haven't you included ethnicity breakdowns in that, given we know that Māori are much more likely to be hospitalised in COVID-19?
But basically because DHB and age, the DHB and age sub milestones are essentially a proxy for that, and we don't want to stigmatise on the basis of ethnicity. So at 85% nationwide and 80% for each DHB and 70% plus for each age band and 10-year bands, you're going to get very good coverage across Maori and Pacifica, and you'll see in the plan we specifically identify a whole range of different measures to increase uptake. It is really important we get those uptakes right, but as part of a formalised milestone, we don't want to end up stigmatising a particular ethnic group on the basis that the country's being held back because a particular ethnic group, Maori or Pacifica, for example, didn't get to a particular milestone. I think that would be actually quite damaging to the social fabric of New Zealand.
We have a couple of final questions.
Yeah. Look, can you just clear up this question about the rights of employers? Because on 22nd of September, you urged employers not to reject the unvaccinated. Now today you're saying that employers can reject the unvaccinated. Why did you change your mind?
Well, I'd want to see the actual quote rather than just a summation. That's a headline by a news media organisation. I've made that very clear that I want to see exact quotes. What is true is that there will be some employers who will be able to cope with the unvaccinated workforce, and that is because of where they're working, how they're working. But there are other employers under the health and safety legislation who will have to take a strict line, and that is something they all need to look at. If someone is possibly, just give an example, working by themselves out on a farm, they may not be in the same health and safety situation for COVID-19 as, say, somebody who is working in a factory. So we just need to be sensible, give employers the tools, and also give them some, let's say, some guidance, because there has been little or no guidance from the government on what employers can and can't do. They need guidance, and they need to know that they're not going to be on the thick end of either unions or the government if they take a particular stance to protect the other workforce.
Last question, anyone? No?
Thank you.
Oh, no, it's just one of
This one.
So we're looking at locating them near Auckland Airport. We announced that a few months ago. The reason for that is obviously it's the major point of entry for most people into the country currently, but also there is spare land there. Looking at modular housing, single storey, not connected with walkways and things, and plenty of good ventilation. I mean, when you stand back just from a helicopter view, you look at the way we do it at the moment. We put people into hotels in the centre of Auckland. When this most recent outbreak is likely to have come from the Crown Plaza, those Aucklanders on the live stream watching will know the Crown Plaza is literally right in the middle of Auckland's an office block connected to the building. Then we put a vaccination centre next to it. I mean, it is actually a bit nuts when you think about it, and I think Professor Nick Wilson called it crazy. It is crazy. So we should be doing what the Australians are doing. And we've put some indicative costings in the plan. Yes, it will take money, but of course the cost of a lockdown for the country is $1 billion a week. We've got to get away from that. It's pocket change in comparison to the cost of a lockdown. So we should be doing what other places are doing, building purpose-built quarantine. I think there's now essentially a consensus that would be a good idea.
Has said that it might take up to 18 months.
Well, when there's a will, look, these guys, these guys are hopeless at building anything. When there's a will, there's a way. Use the Public Works Act, fast track consents. Just get on with it. It's just hopeless.
I've been in a factory in Christchurch that makes basically flat packs houses. They could be put up in a day and a half, 3-bedroom houses. These people in government at the moment, well, thank goodness they weren't in charge during the Christchurch earthquakes, because we'd still be clearing the rubble away now.
Absolutely.
It is absolutely appalling that there is so little intellect or even ambition from the government in how to get New Zealand back to any sort of level economic playing field, or even being reconnected. This fear locking down all the time is just, it is appalling.
Okay, good.
That's